Welcome to CEO Money. I'm Michael Yorba. Thanks for joining us. I have Andrew Lee, co-founder and CEO of Buoy Health with me today. Andrew, welcome to the show.
Thanks so much for having me.
My pleasure. Give our audience a little background on yourself and also your company, and then I want to hear about the patient journey.
Sure. So a little bit about myself. I'm a physician by training. I started Buoy during my last year of medical school at Harvard. I was doing a rotation in the emergency room, and I was seeing a ton of patients who were Googling their symptoms, getting scared by what they had read on Google, and ultimately doing the wrong thing, either coming in way too early or when they shouldn't have, or worse, coming in way too late.
Right.
When they had gotten sicker, and we had to do something more drastic to help them. Right around then, my dad got sick. He had a mini stroke. He didn't go to the doctor when he should have. When I asked him, why don't you call me or one of my sisters who are also in medicine, he said, you guys are working. I was like, okay, why don't you Google it? And he said, what am I going to find on Google? And for me, that was an emotional tipping point that led me to leave. So back in 2013, I took a sabbatical from school 3 months before graduating and started Buoy with 3 other people. And we became obsessed with the care decision, which, to your question about the patient journey, which is when you initially get sick and you're having to decide where to go. Do you go to the ER? Do you go to urgent care? Do you go to primary care, telemedicine, nurse call lines, healthcare coach, specialists? It seems that healthcare just continuously adds more doors by which you have to choose which one to go through. And so we set out to build a program that can help patients understand which door is most appropriate for them. So we built an AI, an artificial intelligence program that interviews patients like a doctor. It basically figures out of the 30,000 questions it could ask next, which one is most important. Ask that question, and after you answer it in real time, re-ranks them and re-ranks all 2,500 possible diagnoses to say, okay, which next question is now most important. So it's really similar to how a doctor reasons and thinks. So after about a 2 or 3 minute interview, we narrow the world of diagnoses down to 3 and what they should do about it at a 90.9% accuracy rate relative to doctors, which we studied in urgent care. And the goal is essentially to get people to the right type of care at the right time. This year, we're on pace for about 40 million individual users in the US. We're backed by Optum and F-Prime, 2 venture firms. And that's it.
Brilliant. That is brilliant. I want to commend you on you and your team on that. All right. You're also bending the healthcare cost curve. Talk to us about that.
Sure. So we have really the ability to do a lot of tests on our users because we have so many of them. And so one of the studies that we ran relatively recently was we started asking patients what type of care they're looking for when they first started Buoy. So when they first come on, we ask them what kind of care they're looking for. And then after they finish the program, after we tell them what is most likely going on, we then ask them, where are you headed next? And so it's kind of like a pre and a post and some sort of intervention in between. And what we saw was that, for example, of people who originally wanted to go to the emergency room after using Buoy, 73% of them decided to do something less severe. Of urgent care, 56%, primary care, 35%, telemedicine, 50%. And so if you multiplied how much they would have cost before times what they would have cost after using Buoy, we are saving about $32 every single time someone uses our product.
So $32 on what size bill are you talking about? I'm trying to get in my head the percentage of healthcare cost savings by using Buoy.
So
I know it's all over the board depending on what's going on, but give me an idea.
So what I'm saying is that every single time someone uses Buoy, whether they're deciding to go to the ER, whether they're just originally going to stay at home, the average cost savings is $32 per use. So the average person gets sick about 3 times a year.
Right.
And then you imagine that they tend to Google their symptoms when they've had symptoms for less than 12 hours.
Right.
And they go to the doctor at about 72 hours after they originally got sick. And so the number of times they could use a program like ours is 3 times you get sick, you're likely to Google or search 2 to 3 times before you end up doing something. So you just kind of multiply that out. So 9 times 32, essentially.
Actually, if I may, it seems to me the healthcare savings are a little bit bigger than that, because that's 32 times relative to the other apps. But if you've saved them from unnecessary visits to the wrong place, you saved them in time, you saved them in gas, you saved them in other healthcare costs that are outside of this parameter that you mentioned. It seems to me that the blended cost savings are bigger than what you had mentioned. You've greatly understated the benefit of what you're doing. From what I see, and I'm just an outside guy trying to connect the dots on this.
No, I appreciate that. Yeah, you're right. I should probably beef that number up.
Well, somebody's going to beef it up, because when they say, I didn't have to go to that doctor because I got the proper diagnosis in 2 minutes or 3 minutes of using my app, you save me a lot of time, because I don't have the extra time to go to the wrong thing and do the wrong thing. You know what I mean?
Totally. You're absolutely right.
That's a brilliant business model and way to help humanity while you're helping yourself and your team. Let's talk about how you differ from, because somebody's going to bring this up, WebMD, and because you're obviously in a competitive industry sector, but you've got a differentiator that's disruptive, and I'm going to bring that out.
Sure. So there have been symptom checkers like WebMD for decades. And symptom checkers have largely been rejected in the marketplace. And the reason behind that is the underlying inaccuracy of symptom checkers. So there was a paper that came out of the BMJ about 3 years ago that looked at the accuracy of symptom checkers, and they were found to be about 34% accurate, which is pretty terrible. And the reason why they're inaccurate is that the underlying technology is relatively rudimentary. So they use hard-coded decision trees. So it's basically hard-coded questions. I'm going to ask you a question about fever, then I'm going to ask you a question about a cough, and then I'm going to ask you a question about, the way that you're walking, whatever that may be. And depending on how you answer those questions, it's very binary about which path you take. Now, the fact of the matter is, the way that physicians reason and think is in no way like a decision tree.
Right. Because
the world isn't as binary as take a right here, then a left here, then a right here. There's a lot of statistics, honestly, into the variability of how any one patient may present with a particular diagnosis. And so the main differentiator is the underlying algorithm and how that works. So as opposed to a symptom checker decision tree, we actually read by hand over 22,000 clinical papers to basically build a statistical understanding of medicine. So I could tell you, for instance, that if you're a smoker, you are 4 times more likely to have pneumonia. I could also tell you that if you have pneumonia, you have a 90% chance of having a fever. All of that based on these 16 papers that we read by hand to understand pneumonia. And so the algorithm is now, instead of having someone just predetermine what questions to ask, can now do an optimization that's statistically driven, just like a doctor's questions are statistically driven, to say, of the 30,000 questions I could ask, for example, smoking, which one has the most impact on what the diagnosis is? And after they answer it, you can dynamically derive the next question as opposed to having a hard-coded question tree.
I get it. And plus, the machine learning is going to give you better questions and answers as you go forward from the data stream that comes through it. I get it. Is there anything else before we close that you wanted to bring out in today's segment on what you're doing? And I'd love to have you back again to hear what the new processes and products are that come out of Buoy.
Sure. I think you kind of alluded to our business model, and it's not super clear cut what our business model is when you look at our website, for instance. We've really started to focus now on the employer, because at the end of the day, the group or the institutions within the U.S.'s healthcare ecosystem that has to foot the bill are either employers or the government. And then sometimes the payer is footing that bill. But specifically on the employer side, they're the ones who are most worried about where the patient ends up going and what kind of costs they entail. So
Right.
we're really now focused on creating a customized version of Bouoy for employers that helps their patients or helps their employees get to the right type of care, the right services within their network of services that they've contracted with.
That's going to be well received. What do you have any estimates on when that's going to come to market?
Actually, it's already on the market. So we have signed, thanks. So we've signed our first employer a couple of weeks ago, and now we're expanding within the employer market.
My congratulations. You guys are well off onto a great path. You're gonna make a big difference in medicine, telemedicine, and the whole sector as a whole. Excuse me. Andrew, it's been a pleasure having you on the show. I hope to have you back and discuss further improvements to what you're doing. You've already, from what you told me, changed the face of medicine as it is.
Thanks. It's very nice to say. Happy to come back anytime. Thanks for having me.
My pleasure. You've been watching CEO Money with Michael Yorba. Thanks for joining with us. And like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel. We'll have more great content for you right after this.